About 13 million children in South Africa live in poverty, despite the government spending 10% of the GDP to address child poverty. This is according to a report by the Nelson Mandela Children's Fund. The child poverty study highlights South Africa's murder rate of 5.5 per 100,000 children, which is 4 times that of the global rate. Joining us now to discuss this is Nelson Mandela Children's Fund's CEO, Dr. Linda Ncube-Nkomo. Doctor, thank you so much for your time and for joining us this morning. Now, you conducted a study as the Nelson Mandela Children's Fund. Talk to us about your findings with regards to the current state of child poverty in the country, and what are the most pressing challenges that you found that are faced by approximately 13 million children who are living in poverty?
Good morning, Katlego, and good morning to your viewers, and thank you for having us on the show to talk about the study. The study shows that between government, the private sector, and NGOs, a tremendous amount of money is going into addressing the needs of the 13 million children that you talked about. Now, this is a study that was done by Deloitte Africa in partnership with Nelson Mandela Children's Fund. And so they used a multidisciplinary team to come up with the findings that are then shared in the report. So this report is showing that government is spending plus or minus, so an estimated 700 billion rand a year on child-related expenditure, which includes free schooling, nutrition at schools, as well as the social grant that gets given to children. Now, what we find is that specifically with the social grant that's intended to assist these children, that grant for a lot of instances is the only source of income in the home. So that 500 Rand grant then has got to be spread throughout an entire family. And so it undermines, or it's greatly compromising the nutritional value of food that children are getting. So that's on the expenditure side. What is, the manner in which the expenditure is going in, trickling down. And we're talking about, not small sums of money when you consolidate the numbers, but the children ultimately are not benefiting from the food aspect of the grant in a manner that would really help them developmentally from the time that they are born up to the point that, they're getting into learning facilities. And I think the important thing that's coming out of this report is that we need to go back to the drawing table and say, we've got this policy, we've had it for X number of years, it's not giving us the results that we need. How should we be investing differently in order for us to start getting the results that we need? What we also did was to use a longitudinal study that is done by the NID that tracks families over a period of time. And that study showed that, if a child can get and finish matric, the distance between the children who come from privileged homes and those who don't, but who do finish a tertiary qualification, once they get into adulthood, the difference from an earnings perspective or from a financial perspective, starts to be closed. So we need to be looking at these 13 million children. How do we invest differently so that we can cut that generational cycle of poverty? Because poverty is generational. So if we don't intervene in the correct manner that benefits the children, I can guarantee that their children are most likely to also be on grants that are coming from government. And I think the other finding that's important is the economic potential economic contribution that is lost, the human capital deprivation to the country that we saw from the study. And basically what the study is saying is that if we invested differently and we can get these children to meet their full economic potential, whether as employers or employees, they could contribute an estimated 1.3 trillion rand into the South African economy. And that's a huge sum of money for us not to stop and say, well, how do we invest differently to get that kind of return.
We certainly should be looking into such, especially like you mentioned, for the long-term benefits of these young children. Does your study show in terms of demographics, whether in rural areas or township areas where most of these children are impacted by these high levels of poverty?
No, the study didn't delve into location because basically what we did was to look at what are the government allocations into the different needs of children. But we do know, even though the study does not show that the majority of children that we will be talking about are likely to be found in rural areas and in informal settlements and in townships. So we're not going to be talking about children that, for example, would be found in fourways. We are likely to be talking about children that are in deep, hard to reach rural areas before the middle class are located children.
Right. You spoke a little earlier on about the gaps that exist in the current approach in terms of how we are dispersing all the resources that are put towards the children who are in poverty. Why do you think it's taken us so long to even just realize that these approaches are not working?
Well, I think, there's always so many things that are happening at any given point in time. And I can't answer for a policy level, but if I just think of the multiple things that are happening at any given point in time, it could be that we've said, look, there's a grant for children, they're getting free food at school, there's this and the other in place, so at least where children are concerned, we're okay. But we've not taken the time to holistically look at the return, the social return on investing in children from the monies that are going into them. And I must say that this work that Deloitte has done for us is a groundbreaking piece of work that's been done over a period of about 8 months. Because as the work was being done, they'll come back and say, oh, you know what, Dr. Linda, actually, we're taking longer than we thought we would to look for this information because we can't find people who have done similar work. And by similar work, I'm looking at the holistic cost. So you might find that someone would have done work that focused solely on one element of a child's need versus the return. Whereas in this instance, we looked at the holistic picture. So I think now is an opportune time because now we've got the numbers. Now the work has been done. If it wasn't done before, well, it wasn't done before. But I think the important thing is what do we need to do differently now that we know what it's costing us and we know the opportunities that are lost by this underdeveloped human capital in South Africa. I think that's really where we want to focus the conversation and to really bring in, many minds to look at this issue so that from the diversity of perspectives, we can come up with a solution that says the difference that we need to start implementing is this, and this is the results that we can expect to see from it.
Now, speaking of that implementation, Doc, we know across the headlines over the past couple of months, we're seeing a lot of young children, especially those in townships, that have been dying from consuming snacks that have been bought at spaza shops. Do you think such studies and data coming from such a coalition would assist in how we then approach some of the instances where we're seeing children dying in those instances?
I think with the issue for us is how do we prevent preventable children's deaths? Because we're not going to stop with all the food that can be provided for children. We're not going to stop them wanting to skip off to a spaza shop and buy a little snack that can't be produced at home. And I think the focus in this instance has got to be health and safety paramount, making sure that whatever food children have access to is safe to eat and is produced in an environment that has been signed off as safe for the production of food for children. But this is such a complex issue that needs, questions to be asked like, how does an industrial pesticide end up in backyard spaces that are selling food not only to children but to communities, because that's not the kind of chemical that should have been found in homes in the first place. But from a perspective of food, I think it's really about focusing on ensuring that any food that gets into the hands of a child is safe for consumption at every given time that children are buying or getting food at home.
Right. So coming back to the study, Doc, does this then influence any specific initiatives or programs in the future that the Nelson Mandela Children's Fund would look to put in place in order to address child poverty? And how are these efforts aimed at making this a tangible impact?
So in this particular instance, there are a couple of programs that we already have at the fund that are intended to address this. One is a program that looks at child safety and protection, which speaks to the issue of violence against children that you talked to when we started. One is looking at under 5 mortality, and I think the bigger issue that needs to be brought into the under 5 conversation is about what happens antenatally. Before a baby is even born, does the mother have sufficient food to eat? Is there a safe place for her where she will deliver the baby? What is her state of mind? Because all those are important for us being able to deliver a baby that is safe and that is healthy and can meet their developmental milestones. But the one that needs to be scaled up that we do have is the one that says every home, every piece of vacant land in a church, in a school, in a community should be converted into a food garden, because then we start to address the low-hanging fruit of there is no food in the house. Because if we are able to plant, say, spinach, which we know can be harvested within 60 days, we know that there is a source of iron that people can easily be able to access. And then to bring into the conversations the retailers and say, can we start putting food baskets in communities so that instead of food being thrown away and tremendous food waste being part of the lives of South Africa, that food gets put into baskets where people can literally walk to that retailer and get what they need. Mm-hmm. But it also needs honesty on the part of us as community members to make sure that food that's intended to be for free and to help desperate children doesn't end up being food that's been taken for resale elsewhere. So I think there's a lot that we can do on the ground long before we can even be looking at policies being changed. Things like keeping children safe at home, at school, in communities. That's something that people that have access to children should be doing. And then the food gardens are something that all of us can be challenging each other to be doing that. Let's plant food gardens. Let's plant fruit trees so that food can be easily accessible in communities where it's desperately needed.
So, Doc, in relation to these programs that you're currently running, what are the challenges that you face in measuring the impact of poverty alleviation efforts?
I mean, the challenges are always going to be if multiple organizations are working in the same environment, who is the one that's ultimately responsible for the change that has been done? So it does also need us to have strengthened monitoring and evaluation systems across the board, whether it is at the Children's Fund or whether it is at government level, to be able to measure the impact of what we're doing is becoming more and more crucial for us to know whether the investment that we're doing is the right investment that's giving us the right result, the right returns. So really, at a global level, strengthening those monitoring and evaluation and impact studies, regular impact studies, so that we don't continue going a path that's not giving us results, but we don't have the data to tell us that it's not giving us results.
Most certainly. And I mean, you spoke earlier about it's starting at grassroots levels, at the base of the communities where we take care of children in order to protect them and to also ensure that we are planting food so that there is food readily available from the back of our gardens. From a policy change perspective, what would you recommend in terms of making sure that we better address this issue of child poverty? What role do you think that governments play together with civil society organizations?
I think one of the important things that we need to be looking at, the first thing is to change the language that we're using. I mean, it sounds like a small thing, but I think it will point our minds and in the right direction if we've got the right picture towards what we should be working with. And instead of talking about alleviating poverty, let's talk about, as South Africa, we want to actually eradicate poverty. So being able to give ourselves a measure that says, what is the percentage of children that is acceptable, and it should really be zero, to be living on a grant but also making sure that those children, we can carry them throughout the system, follow them throughout the system to make sure that they don't fall through the cracks by the time they get into the end of grade 7 because it was hunger that made them unable to cope with school. And they just decided, you know what, I can't do this anymore. Let me just go and find a job. Let me just share with you, Katlego, something that I read on social media early this morning. A young 16-year-old boy who's been raised by his grandmother, that's the only living relative, on a grant. And he's decided he wants to take the pressure off his grandmother, drop out of school and find a job. And the question that he was asking was, as a 16-year-old, will anybody employ me because I'm underage? And we need to make sure that 16-year-olds are not having to make those kind of decisions of dropping out of school because I must man up. His words were, I must be a man and help my grandmother and my sister. So as a policy, we should be able to say, how do we make sure that there is in homes on a sustainable basis until children are self-sufficient and have been given a fighting chance to be able to meet their human capital development and be able to get into meaningful work that can actually sustain them and their families for the generations to come.
All right, Doctor, this is very insightful. Thank you so much for your time. We certainly do hope that, like you say, it starts at grassroots level.